Did you know there are 3 methods to prevent your tinnitus from continuing to worsen? And beyond that, when many people have chosen to follow these 3 methods, the majority have been able to reduce their constant ringing. It doesn't promise to eliminate it, although that has happened for some, but the most important thing is stopping it from getting worse. Number 1. Avoid places with loud noise. If you can't avoid them, such as when traveling by plane, use earplugs for the entire trip. Or working in places with loud noise, if your job allows it. Avoid the constant use of headphones, especially for music or movies at high volume if it's not really necessary. Remember that hearing loss can cause tinnitus. Another important tip to remember is the use of wireless headphones. The radiation from Bluetooth can affect the brain over time. Number 2. Check with your doctor to see if you are affected by candidiasis. Candidiasis is a yeast infection that occurs when a type of yeast called Candida albicans grows out of control. It commonly affects your mouth, skin, and intimate area or private area. Candidiasis isn't a serious infection, but you still want to seek treatment right away. Antifungal medications can effectively treat and clear up the infection within 2 days to 2 weeks. I recommend that you research Candida albicans more thoroughly. This is because it has been reported that many people, when they were able to control and reduce Candida to its lowest level, felt that their tinnitus decreased significantly and in many cases even disappeared. Regarding the relationship between Candida and tinnitus ringing or buzzing in the ears, there are some important points. Point 1. Systemic inflammation. An overgrowth of Candida can cause inflammation and release toxins, such as so-called candidotoxins, that affect circulation and the nervous system. This could exacerbate the perception of tinnitus in some people. Point number 2. Microbiome imbalance. Intestinal candidiasis can alter the absorption of essential nutrients, including B-complex vitamins and zinc, which are important for inner ear health and auditory function. A deficiency in these nutrients may intensify tinnitus symptoms. Point number 3. Immune hypersensitivity. Some people with Candida overgrowth develop hypersensitivity reactions or allergies that affect the middle or inner ear, which could worsen tinnitus. There is no solid scientific evidence that Candida directly causes tinnitus. However, people with chronic candidiasis sometimes report worsening of the ringing, likely due to inflammation, stress, and nervous system imbalance. Now, let's go to method number 3. Check your cervical spine neck area. Can sometimes be related to tinnitus, ringing or buzzing in the ears. This is often called cervicogenic tinnitus or somatosensory tinnitus. It happens when problems in the neck affect the nerves, muscles, or blood flow connected to the auditory system. Here are the main ways the cervical area may influence tinnitus. Nerve interaction. The nerves from the upper cervical spine, especially C1, C3, connect with pathways that interact with the auditory system in the brainstem. If there is muscle tension, joint dysfunction, or nerve irritation, it can change how sound signals are processed and increase the perception of tinnitus. Muscle tension and posture. Tight muscles in the neck and jaw, such as the sternocleidomastoid or suboccipital muscles, can influence nearby nerves and blood vessels. Poor posture, like forward head posture from computer or phone use, can increase neck strain and sometimes worsen tinnitus. Blood flow changes. The cervical spine surrounds arteries that supply blood to the brain and inner ear. Neck stiffness, inflammation, or misalignment may affect circulation, which in some people can intensify tinnitus symptoms. Trigger points in neck muscles can refer sensations to the ear or head. Some people notice their tinnitus changes when they move their neck, press certain muscles, or clench their jaw. Next, I'm going to give you some signs your tinnitus may be cervical related. Number 1. The sound changes with neck movement. Turning, tilting, or stretching your neck makes the ringing louder, softer, or different in tone. Number 2. Tinnitus changes with pressure. Pressing on certain areas of your neck, shoulders, or jaw alters the sound. Number 3. History of neck injury, such as whiplash or strain from poor posture. Number 4. Shoulder and upper back tension. Tension in these muscles can affect nearby nerves and structures connected to the neck and jaw. In some people, this can trigger or worsen tinnitus, especially if it changes when you move your neck or shoulders. Now, I will mention some simple exercises to help relieve cervical-related tinnitus. But remember, before doing any exercises, consult your doctor or physical therapist regarding your condition. Number 1. Physical therapy for the cervical spine. Physical therapy for the cervical spine focuses on improving neck mobility, reducing muscle tension, and relieving symptoms such as neck pain or cervical-related tinnitus. Number 2. Neck stretch and side tilt. For this exercise, you must sit or stand tall. Gently tilt your head toward one shoulder, bringing your ear closer to it. Hold 15 to 30 seconds, then switch sides. Repeat 2 or 3 times. This exercise helps release tension in the sides of the neck. Number 3. Chin tucks. Gently pull your chin straight back. Hold 5 seconds and relax. You can repeat this exercise 10 times. This chin tucks movement helps realign the cervical spine and reduce forward head posture. Number 4. Levator scapulae stretch. Put one hand behind your back, tilt your head to the opposite side, rotate your head to aim your chin down to the armpit. Use the opposite hand to apply a little additional stretch. Should not be painful. Hold for 15 to 20 seconds each side. This exercise targets a deeper muscle that frequently contributes to neck stiffness. Number 5. Neck range of motion. On your bed, move slowly. Look down and up. Look right and left. You can do 5 to 10 repetitions each direction, facing down and facing up. This exercise keeps joints mobile and reduces stiffness. Number 6. Shoulder blade squeezes. Face down on the floor and support your forehead with a towel or small pillow. Pull your shoulder blades back and down. Repeat 10 to 15 times. Shoulder blade squeezes help to strengthen these muscles, promoting better alignment of the shoulders and upper back. Keep these tips in mind before starting the exercises. Movements should be gentle, not painful. Avoid sudden or forceful neck motions. And stop if tinnitus gets noticeably worse during exercise. Now, let's explore some proven ways to manage tinnitus. Sound therapy. One of the most effective and widely used methods is sound therapy, which uses background noise to make tinnitus less noticeable. It works by masking the ringing caused by tinnitus. Background noise can be used to mask the ringing, such as white noise, soft music, fan noise, raining sound, waterfall sounds, and ocean wave sounds. Basically, using background sounds is one of the best ways to distract your brain from the ringing. Another proven ways to manage tinnitus is reduce stress and anxiety. Believe it or not, stress can make tinnitus worse. When you're feeling overwhelmed with stress, try the following. Take deep breathing. Also, try cognitive behavioral therapy. It is a type of therapy that helps you manage the stress and anxiety caused by tinnitus. Remember something important. Tinnitus often doesn't fully go away, but many people train their brain to ignore it over time. The goal is reducing how noticeable and stressful it feels, not just eliminating the sound. While older models focused on ear damage, newer research shows tinnitus is driven by abnormal brain activity and sensory processing. Most people think tinnitus is just an ear problem, but science is telling a different story. Here are 3 facts based on the latest research. Number 1. Tinnitus is a brain condition, not just an ear issue. It happens when the brain overcompensates for missing sound signals and creates its own noise. Number 2, we're finally learning how to measure it. New studies can detect tinnitus through brain activity and even physical responses like eye movement. And number 3, treatments are improving, and some actually retrain the brain. New approaches like sound plus nerve stimulation are helping reduce symptoms, not just mask them. Before we finish, here's something important to remember. We're not at a cure yet, but we're closer than ever to understanding what's really going on. And that means real progress, real hope, and better solutions are finally within reach. Thank you so much for taking the time to watch and learn with me. I really appreciate your attention and curiosity. It means more than you know. If you found this helpful, feel free to share it with someone who might need it too. Take care of yourself, and I'll see you in the next one. Goodbye.